The consumption of ultra-processed foods has become a major public health concern due to its direct link to chronic diseases, increased mortality rates, and a growing dependency on artificially enhanced products that offer little to no nutritional value. While the convenience and affordability of these foods make them appealing to a broad segment of the population, particularly in countries with fast-paced lifestyles, their long-term consequences for human health are severe and often irreversible. Despite mounting evidence highlighting the dangers of ultra-processed foods, their presence in modern diets continues to expand, contributing to the global rise in cardiovascular disease, metabolic disorders, and even neurological conditions. The scientific community warns that failing to address this issue could result in a dramatic increase in preventable deaths and a healthcare system burdened by illnesses that stem directly from poor dietary habits. One of the most alarming findings regarding ultra-processed foods is their undeniable role in cardiovascular disease. Research published in The Lancet Regional Health Americas in September 2024 analyzed data from over 200,000 adults in the United States and found that individuals who regularly consumed these foods had an 11% higher risk of developing cardiovascular conditions and a 16% higher likelihood of suffering from coronary artery disease. These statistics are deeply concerning, as heart disease remains one of the leading causes of death worldwide. An additional study that included 1.25 million people established a clear link between the intake of ultra-processed foods and a 9% increase in the likelihood of suffering stroke. This growing body of research confirms what health experts have warned for years. Diets dominated by highly processed, industrially manufactured foods are a silent but deadly threat to cardiovascular health. The dangers of these products extend far beyond heart disease. Studies presented at the 2024 annual meeting of the American Society for Nutrition, based on data from over 500,000 adults, revealed that a diet rich in ultra-processed foods is strongly associated with an overall increase in mortality rates. This includes deaths caused by cardiovascular conditions, diabetes, and other chronic illnesses. A separate study published in the BMJ in May 2024, which tracked more than 100,000 people over 3 decades, further reinforced the link between high ultra-processed food consumption and elevated mortality risk, particularly in individuals who consumed large quantities of processed meats and sugary beverages. These findings indicate that the cumulative impact of a poor diet is not only damaging, but potentially life-shortening. The mechanisms by which ultra-processed foods contribute to disease are deeply concerning. These products are characterized by their extensive modification from their original food sources, often containing artificial additives, preservatives, refined oils, modified starches, and excessive amounts of added sugar and salt. Unlike minimally processed foods that retain most of their natural properties, ultra-processed items are engineered to enhance flavor, extend shelf life, and maximize consumer appeal at the expense of nutritional integrity. Dietitian Vanessa Rossetto, cited by Today, highlights that these foods contain chemical compounds specifically designed to make them more palatable and addictive, effectively altering natural eating behaviors and encouraging overconsumption. The list of ultra-processed foods is extensive, but some of the most harmful include processed meats such as sausages, hot dogs, and deli meats, as well as sugary beverages, packaged baked goods, and ready-to-eat meals. These items have been linked not only to obesity and metabolic syndrome, but also to an increased risk of colorectal cancer, non-alcoholic fatty liver disease, and severe mental health disorders such as anxiety and depression. The cumulative impact of these conditions paints a bleak picture, as they contribute to declining quality of life, increased healthcare costs, and the prevalence of diseases that could otherwise be mitigated through better dietary choices. Perhaps one of the most alarming aspects of ultra-processed food consumption is the way it disproportionately affects lower-income populations. These foods are often marketed as affordable and convenient, making them a staple in many households where fresh, whole foods may be financially out of reach. This creates a vicious cycle in which socioeconomically disadvantaged groups are at greater risk for diet-related illnesses due to limited access to healthier options. The aggressive marketing tactics of food corporations only exacerbate the issue, as they continue to promote ultra-processed products as quick, easy, and desirable, often targeting children and young adults who are particularly vulnerable to unhealthy eating habits. Despite the overwhelming evidence of harm, the consumption of ultra-processed foods continues to rise, fueled by busy lifestyles, widespread availability, and the addictive nature of these products. Governments and health organizations have attempted to address the problem through public health campaigns, food labeling regulations, and taxation on sugary beverages, but these efforts have been met with resistance from the powerful food industry. Meanwhile, the burden of chronic disease continues to escalate, placing immense pressure on healthcare systems and shortening the lifespan of millions of people worldwide. The most effective way to counteract the dangers of ultra-processed foods is to adopt a diet that prioritizes whole, nutrient-dense ingredients while minimizing the intake of artificially enhanced and chemically modified products. Experts recommend that at least 85% of one's diet consist of fresh, unprocessed foods such as fruits, vegetables, lean proteins, whole grains, and healthy fats. This approach not only reduces the risk of diet-related illnesses, but also supports overall well-being by providing essential nutrients that promote longevity and vitality. However, changing dietary habits requires a conscious effort, as well as systemic changes that make healthy food options more accessible and affordable for all. The rise of ultra-processed food consumption is a ticking time bomb for global health. Unless urgent action is taken to reduce dependency on these products and educate the public on their dangers, the consequences will be dire. Increased mortality rates, widespread chronic illness, and a declining quality of life are all foreseeable outcomes if current dietary trends continue. The responsibility to make better choices falls on individuals, communities, and policymakers alike, but awareness is only the first step. Without meaningful change, the toxic effects of ultra-processed foods will continue to take a devastating toll on future generations.